I was telling Terry this morning that looking at the program, it feels a little like a satellite of NIH being here today. And so I am very pleased to have the opportunity to participate and to join my colleagues in congratulating you on the program and also wishing you well as we move forward. But in addition, to have a few minutes to speak a little bit about the science that we support as part of this overall enterprise. And so I appreciate the opportunity to do that as well. I will do it in context so that it's not too myopic, but just to have that chance to give you a little additional information and also highlight some opportunities as well. So let me just add my words of welcome to Alan and everyone else for the last, I know we're day 3 here. But just to give you a little bit of an overview, for over a quarter of a century now, the National Institute of Nursing Research has been supporting science, training, and activities to produce knowledge that will improve patient care across the spectrum. We are one of the 27 institutes and centers at NIH, and we do build an evidence base primarily that enhances quality of life. That's our major goal. And because chronic pain does affect approximately 100 million people yearly and costs in excess of $600 billion a year, but that's not only in addition in medical treatment and interventions, but also in terms of pain and suffering for people of every age. That makes pain an important focus for us in the National Institute of Nursing Research. So we do study such things as advancing science by studying the genetic underpinnings, biological and genomic underpinnings of pain. Also creating and testing out improved tools for measurement, for self-management for pain, particularly for people who are living with more than one chronic illness, which these days is a majority of the population 50 years of age and older. Quite a different situation than previous years. Primarily, we are person-centered rather than disease-centric, or as described, we're disease-agnostic, but we do focus on advancing symptoms, alleviating symptoms, and identifying strategies to do that. So essentially, discovering new ways to eliminate or manage adverse symptoms, including pain, increasing quality of life for patients, and also with a focus on families and caregivers, which is a bit different than some of the other activities at NIH. Recently, some of the areas that of increased activity for us include identifying potential molecular targets for addressing chronic pain, particularly one of the more recent findings is those with spinal cord injury. Developing personalized therapies for using health monitoring devices. We have that in our regular program and also in our SBIR program where we have a fair amount of activity there. And recently are one of 2 institutes at NIH, the other being the Institute of Bioengineering and Bioinformatics, that have joined together with a program announcement to increase activity in that area. Also studying pain in children, particularly with GI disorders, as well as recognizing pain in pediatric populations, which is particularly difficult among the groups that have difficulty communicating with little children. Also, all of these really are geared toward pointing the way toward more effective strategies for relieving pain, and also for helping to decrease pain related often to treatment side effects. Now, because we are multidisciplinary and pain is also multidisciplinary and complex, we tend to be a major player in trans-NIH activities and also trans-professional activities across the country. And so that's one of the major reasons that we are part of the Pain Consortium and very happy to be one of those major players. And also partnering with such groups, in addition to universities, of course, outside groups such as the Patient-Centered Outcomes Research Institute, or PCORI, which I know is, for you all, will become much more part of your landscape. Most of you are pretty familiar with the Pain Consortium, but just to highlight some of the areas that we're particularly involved in, one of these is the Coast Pain Centers in Education, which happily is one of the areas of the IRM report on pain that stresses training the next generation. So we're very much involved in that. Also, the pain registry, Stanford Pain Registry as well. So those are two of the areas that we're primarily committed to. But we're also, as part of the pain consortium, able to elevate visibility for pain. And of course, we're very ably assisted in that by Terry Cowley, who is a member of the Interagency Pain Research Coordinating Committee, which is really has, I guess I would say it's an offspring of the pain consortium, but it's actually larger, more all-encompassing. So that, but we really, it is a major part of bringing attention to pain. So those centers are very important to us to educate the next generation. The other thing I would like to mention is that we do have a small intramural program on campus, which is very much focused on biology of symptom science. And among the symptoms that we are focusing on is pain. It's one of several symptoms, so it's not the central focus, but it's one: pain, dyspnea, and fatigue are the major symptoms that we are focusing on. So you can look for increased activity there as well. But extramurally, we continue to support a robust program in pain. And we don't specifically have researchers in TMJ, but we do support research that overlaps or abuts some of the areas of particular interest for those of you studying TMJ, including fatigue and just pain in general, localized and generic. So we are committed to that, and we are committed to at least, if not increasing the next generation of researchers, maintaining and hopefully increasing them over time. So just in closing, bringing your attention to it turns out actually there are 27 areas of opportunity announcements, program announcements or RFAs currently active at NIH, which address pain. And so just 3 of those I would bring your attention to, which are the ones that we are most involved in. And those include the research on chronic overlapping pain conditions, mechanisms, measurements, models, and management in pain research, and also health tools for individuals with chronic conditions for effective patient-provider communication, which I alluded to earlier. So with that, that's kind of in a nutshell what we do that embraces or could be embraced by you as a community. And so just in closing, to underscore what has been said previously in these 2 days, that NIH and NINR will continue its efforts in pain research, and that together with you all as partners, we will generate new solutions for pain prevention, management, and care with the goal of improving better health and outcomes for everyone.